next to speak is the first of our Royal College people, and I'm absolutely delighted that it's David Alderson, who from the Royal College of Surgeons, President of the Royal College of Surgeons, talking about the direction of travel as he sees it from the surgeon's point of view. Professor Alderson.
Alistair, thank you very much indeed. I think that there's probably three very important strands that we've learned as a surgical community during the crisis. The first, I think, is the enormous interdependence that we have, that surgeons often used to behave in silos, and we realize now, having had to face a completely new disease, how important it is to, as it were, consider the whole patient journey through the system, the involvement in primary care, the hospital sector, and the social care system. So interdependence is the first thing. The second thing I'd say is the enormous adaptability that we've seen within specialties, surgeons becoming nurses, surgeons becoming experts in ventilation patients, etc. And all of those things, I think, have contributed to really clinician-led change. And I think if there's one lesson that certainly the surgical community have learned from this, is how important it is to take control in order to exert meaningful changes and to be adaptable and to actually deliver better quality care in a crisis situation. As far as the future of surgery goes, then I suppose the crisis has made us realize how important it will be to, if we're to start surgery again in a meaningful way, to separate COVID light, COVID cold, COVID green sites where we have little risk of infection from our COVID positive environments. And there are lots of different models in which we will do that. But the one thing we can be sure of is that the way in which we deliver surgery in the future must be different because of the need for a substantial amount of time in the future to, as it were, modify the way in which we deliver surgical care. I think that if we follow that argument through, then the whole way in which we train surgeons for the future must, as it were, reflect this new system. We may have more hospitals that do nothing but elective surgery and other hospitals that take on emergency surgery and some that do very complex surgery as hubs for that kind of surgery. We'll almost certainly make training more reliant on things like simulation. I think that the greater use of digital technologies in this crisis, even if it's simple things like video conferencing, has given lots of people confidence to adapt and to use new technologies. Things that we were fearful of, I think people will be considerably less fearful of. So surgery is going to change markedly following the restart, and those changes can be, as it were, used in the long-term future of surgery in conjunction with our other colleagues in other specialties with whom we have to work. So I think surgery will be changed and changed forever.